If you've already tried a night guard, taken medication, maybe even had an MRI, and your jaw pain just won't improve, this video is for you. And if you're a dentist who's frustrated because some patients' TMJ pain just doesn't seem to improve, stay with me. Because TMJ disorders are rarely about just the joint. One of the biggest reasons TMJ treatment fails is because of misdiagnosis. All patients do not have the same problem. Some patients have muscle pain, some have joint inflammation, some have degenerative joint disease, some have a displaced disc, and some have altered pain processing signals. All of these are very different problems that require different solutions. But very often they're treated in the same way, and that is with a splint. Sometimes this works, and very often it does not. Another reason TMJ treatment fails is because of inaccurate correlations. Clicking doesn't always mean pain. Pain doesn't always mean that there is degeneration. Very often the symptoms and MRI or CBCT findings do not match. We see patients that have a lot of degenerative joint changes on the CBCT but have no clinical pain symptoms. And very often patients that complain of a lot of pain in their joints actually have completely clear radiological findings. So pain is a complex process. It is more than just what you see on imaging or what you think should be the symptoms or should be the cause. So if you're not diagnosing the patient correctly and if you aren't correlating correctly, then you're just guessing. And that treatment is bound to not succeed. Now let's talk about something slightly more controversial, and that is the correlation between the bite and TMJ pain. TMJ pain is multifactorial. There is no one single factor that is responsible for it, and bite changes very rarely contribute to TMJ pain. There is very little evidence that supports trimming the bite or altering teeth to help relieve TMJ pain. Enamel removal, once done, cannot be undone. So always conservative treatments and science-backed evidence-based management protocols are the way to go. Now moving on to another slightly more controversial topic, and that is the association between sleep apnea and sleep disorders and TMJ pain. Now there is no direct causation or correlation between sleep apnea and TMJ pain. Patients that have TMJ disorders may have sleep disruptions because of the pain levels, and sometimes there may be some causation factors that overlap. But that does not mean that everyone who has TMJ will have sleep apnea, or everyone that has sleep apnea will have a TMJ disorder. Now coming to the role of muscles in TMJ pain. Muscles play a vital role. We use them to move our jaws, to talk, to open, to yawn, to eat, and they're constantly used. So when we clench or we lightly touch our teeth together, it contributes to muscle activity and it can actually trigger more pain and let pain states sustain for longer times, especially coupled with our lifestyle these days that involves long screen hours, poor postures. It's the correct time for TMJ pain to increase and to stay for longer. So it's very important to make sure that pain is not just a physical phenomenon. It is social, it is psychological, it is biological. So you have to take care of all of these aspects to clearly manage pain conditions. If your TMJ treatment has not worked yet and if you're still in pain, it doesn't mean that you're damaged or that you're doing something wrong. It simply means that your condition hasn't fully been understood yet. And if you're a dentist watching this, the aim is not to do more procedures, but to diagnose better. Precision matters more than intervention. TMJ pain that lingers is not because you have failed. It is simply because the condition is more nuanced than we thought before. If this has helped you, subscribe and comment and let me know what you think.